cohort without inducing increases in heart failure. You'll note that the average dose in IRIS was 29 milligrams. This is now a meta-analysis using data from IRIS, PROACTIVE, and a smaller Japanese trial known as J-SPIRIT. And you can see that the overall stroke effect with pioglitazone is on the order of 32%. And these are now some real-world data from the UK general practice database. Depending on the definition of initiation of pioglitazone versus other comparative medications, you can see relative risk reductions, again, in the 30 to 35% range. So I think the effect of pioglitazone in stroke is no longer debatable. It's a strong effect, and I personally feel that the drug is underutilized in this population. Now, to conclude, this is the ADA-EASD consensus report for the management of hyperglycemia in patients with type 2 diabetes. For our patients, our patient today, this woman who had a stroke, she would be brought down this algorithm after metformin monotherapy. The patient has atherosclerotic cardiovascular disease, no known heart failure. She does have CKD, but I think most of us would go down the right pathway because that is a predominant aspect to her comorbidities is a presence of recent stroke. So she should be preferably treated with a GLP-1 receptor agonist or an SGLT2 inhibitor. As I showed you, the effects in stroke patients, at least for the prevention of subsequent strokes, is much stronger for the GLP-1s than for the SGLT2 inhibitors. Now, of course, you can say that CKD may also be an issue here, and if the GFR is at least over 30, perhaps you should get an SGLT2 inhibitor. But focusing on stroke prevention or CVD prevention, I think most of us would recommend a GLP-1 over an SGLT2 inhibitor. I personally, based on the IRIS and the PROACTIVE data, would suggest that this patient is best treated by continuing her metformin, watch the dose because her GFR is around 45, and I certainly wouldn't go above 1,000 milligrams, and then add GLP-1 receptor agonists and or pioglitazone. I think a triple combination, particularly with a low dose of pioglitazone,